I only have a few minutes here, I know, but I did want to eat up a couple of those minutes just by starting with my own land acknowledgement. So we have the beautiful fall colors now outside, and I'm reminded of how grateful I am to call this land my home. This is a picture here of my backyard in the winter. It's hard to believe in only a few weeks it's going to look like this again. We have a moose that visits, a little moose family that visits us pretty frequently in our backyard and our very homemade hockey rink. So I'll acknowledge that I'm coming to you today from Treaty 6 territory. So Edmonton area, excuse me, which we know is a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others. So the reason I wanted to bring this in is because I like to talk about how these are not just words that are spoken at the beginning of a presentation or a meeting, but a representation of a commitment to honoring and reflecting on the relationship that I have to treaties, the land and its gifts, as well as the Indigenous peoples who continue to enrich our communities. So my acknowledgement is not only in respectful recognition of the lands on which I live, work, and play, along with my past, current, and future ancestors of these lands, but is also in recognition that I and my colleagues have a collective responsibility to take concrete actions toward uplifting the connections that we have with all of our relations. And it's through research, clinical work, teaching, and more broadly advocacy that I aim to take some of these concrete actions. So just to introduce myself, I'm a member of the Métis Nation of Alberta. So my dad is Cree and Métis with roots in an Indigenous community about an hour west of Edmonton and is part of the Lac-Saint-Anne Métis community. And my mom is French. So I am Métis, recognized as one of the groups of Indigenous peoples in Canada. That being said, like any Indigenous person, I'm coming to you today with specific lived experience and layers of privilege as a university faculty member. And so I don't ever claim to speak for any Indigenous person or community. Indigenous identity in Canada is complex, as are the experiences of the incredibly diverse Indigenous peoples in this country. I'm also a mom, so I have a picture of my 3 children on this slide. So I have a 2-year-old daughter, a 4-year-old son, and a 6-year-old son. And just on more of a professional level, this is my 6th year as a faculty member in the School and Clinical Child Psychology program. So as of July, I had achieved tenure, so an associate prof now, as well as a registered psychologist. So I'm a child psychologist. I did my PhD in the School and Clinical Child Psychology program, where I now work. So it does feel like I've been around for longer because I wasn't brand new to the faculty or the department when I started. Just in terms of my clinical background, I started out about 16 years ago when I was still an undergrad student working at a forensic psychiatric clinic in Edmonton. So I would work in a day program for people who had been found not criminally responsible. I worked with a psychologist to run relapse prevention groups. I worked as a psychometrist at Alberta Hospital Edmonton for a number of years, and really was just happy to work under the supervision of psychologists to provide assessment and intervention. Then I went back to school to do my master's in human ecology, family ecology and practice at the U of A. So I did a lot of research work at the time with the Community University Partnership for the Study of Children, Youth, and Families, which is known as CUP. They're in the School of Public Health now at the U of A. I also worked with Bentero in Edmonton and really fell in love with community-based participatory research. So I finished up my master's and then I worked for about 5 years in the Department of Pediatrics at the U of A, coordinating the evaluation of a substance abuse and violence prevention program in the community of Musqueam, which is an Indigenous community about an hour south of Edmonton. So although I wasn't doing clinical work at the time, I was heavily immersed in research. I learned so much about ethical practice and about ways to foster the health and well-being of Indigenous children and families, and the long-lasting relationships that can be formed through community research, which was completely new to me, this idea that that research could be relational. And I now have the privilege of doing my own research with Indigenous communities. My heart really lies with qualitative methods such as photo voice. When I was working in Maskwacis, we started a photo voice project to mobilize knowledge about the strengths of the and resilience of the community, just given that a lot of media attention tends to focus on the negative, like drugs and gangs and violence, and health research tends to focus on those things too. So we decided to do a project in partnership with youth and elders and families to mobilize knowledge about community strengths. I now work again in Maskwacis on what's called the early years program. So it's a prenatal to preschool intervention that started as a pilot in Maskwacis and has expanded across Canada. And that's in partnership with the Martin Family Initiative, which is an organization that is based in Montreal. Just gonna look what I have on my next slide. Oh, so I also have a couple of photos here that represent other projects that I'm working on. So I have a CIHR grant right now working with the early years, both to more broadly evaluate the early years program, but also to develop new developmental screening tools for screening Indigenous children with the families that work there or that live there, sorry. I also have a picture of a school here. So I do a lot of work with Boyle Street Education School, which is an alternative high school in Edmonton. So we're looking at better understanding the social, emotional, and learning needs of Indigenous students at the school who have been disengaged from traditional school settings, and also doing some work with the Edmonton Police Service to understand how police can better serve marginalized youth, including Indigenous youth. I'll also just quickly mention here, when I started my doctoral studies, I worked under the supervision of Dr. Jackie Pye, who is an expert in FASD, and so really started to develop a grounding and understanding FASD. And so now I'm part of the Canada FASD Research Network family, so I have a role as an Indigenous research lead with the Canada FASD Research Network. So I offer this introduction to you to situate myself, and so you have an understanding of how my personal and professional ideas have been shaped and the work that my ideas are anchored in. And what I found most helpful for me as a grad student was getting involved in as many projects as I could, being supervised and mentored by lots of different people from different disciplines and who were very different methodologists, very different researchers. So I could understand what I really cared about, what I really wanted to focus my own career on. And it was through exposure to these different activities and people that I gained that understanding about myself. So right now, as an academic, I do research and I also teach. I teach mostly in the area of child development, intervention, evaluation, and I also supervise lots of students, which is probably the best part of my job. I love supervision and mentorship of students. And then just to kind of wrap up here, I wanted to end with some little quotes that I've curated that kind of describe my philosophy as an academic. To teach Indigenous brilliance and success as much as you teach Indigenous suffering and trauma, I think is really important, in particular for health research, because health researchers have often presented bleak statistics about Indigenous people without the context of colonialism and why those bleak realities exist. And also I love this quote about, if in academia we could shift our everyday discourse from I study, I look at, I'm interested in, I focus on, I critique, and shift that to I'm accountable to this area or the children and families who will potentially benefit from my work, or I listen or pay attention to.